Hi Roxanne, my name is Ashley Underwood and I'm an administrator for a critical access hospital. I want to bring some critical priorities needed for critical access hospitals to your attention today. I'm not sure if you're aware that currently 19.3% of the U.S. population resides in rural areas and seeks essential medical care from critical access hospitals. These hospitals treat 7 million patients yearly in the emergency departments and another 38 million in outpatient services. The problem is that as deficit reduction remains a key focus in Washington, coupled with a lack of knowledge regarding the unique circumstances of our rural facilities, the providers such as myself in small or rural areas continue to be in jeopardy of decisions made by legislation. Due to our small size, decreased resources, lack of financial reserve, and high percentage of Medicare patients, greater than 60% of our revenue comes from governmental payments. This means that any payment reduction to Medicaid or Medicare, such as the one that Obama proposes in his 2015 budget, would greatly impact the ability of critical access hospitals to sustain and provide care to our rural communities. Rural hospitals face workforce shortages and rising costs and premiums that continue to drive healthcare costs higher. In addition, access to capital is little or non-existent, and as the average age of buildings, along with advances in technologies, continues to climb, rural hospitals struggle to make these ongoing improvements. While I recognize the need for a reduction in healthcare-related costs, at what or whose expense is this reduction going to affect? If access to care, especially emergency care, is limited to the large population of rural residents, how will this affect outcomes and, in the long run, costs? I ask you to advocate with me on behalf of critical access hospitals to see that they are continued to be provided with the resources to provide high-quality care to our communities and that to help improve the health outcomes for our patients. Essentially, this will make Medicare more effective. The Rural Hospital Provider and Equity Act of 2014 is currently in legislation. This act would extend critical rural provisions that have expired or set to expire and implement new provisions that would benefit rural hospitals and help them remain financially viable. I ask you to join me in support for this act. Do you have any questions regarding what I've told you today?
No, Ashley, I think you did a good point in pointing out the information. Thank you.
Thank you for listening, and please join me in the fight for critical access hospitals.